11:16 here on Tree Country 1330. And you know what? Our fancy little intro for some reason was not playing today, but maybe it's the weather. I'm going to blame it on the rain. That's what we're going to say.
There you go.
But it is the first Monday of the month, actually the first day of the month, so even more special.
Happy August.
Which means it is time for Community Connections, where we make connections with the community. There's my intro. We had no song. We had no fancy song, so there's my intro for the day.
Works. Well, thank you for that. I am Dawn Lowe. I'm with the Greensburg Decatur County Chamber of Commerce, and we do have an event coming up this Friday that I'd like to let the public know about. It is our 37th annual Summer Day of Golf fundraiser. We are going to have a lot of fun, so we capitalize the fun and fundraiser, and we actually have, as of this morning, two spots for two teams left, and that is because we've just had some last minute cancellations. Some things come up. It happens with every event that we host. So we actually have two spots left for teams before we can max out on the course. We'll be at Greensburg Country Club this Friday, 10:30 registration, shotgun start at 11 a.m. We've got some great games of chance played. As always, it's just always a great time out on the course. That was one event, along with our Women in Business conference, that we did not have to put on hold due to COVID. So we were very thankful and blessed that we were able to take that all the way through 2020 and not cancel or postpone that event. So 37 years running strong. So we're excited for that. So if you have an interest in putting a team in here at the last minute and would like a day out of the office, we can help you out with that. Just give us a call at our office, 812-663-2832, and we will get you and your friends set up. Other than that, we have a couple of smaller events that are quickly approaching on the calendar. You mentioned August, and I was like, oh my gosh, like I thought I had so much time in the summer to get things, ready and prepared, and now all of a sudden here it is. It's
wrapping up. Kids are going back to school. It's fall's next month.
Yeah, but that's okay.
Very quickly.
We'll rock and roll with it. So on Tuesday, August the 9th, the second Tuesday of every month is our lunch and learn. We will be hosting Patty's Flowers. Patty's Flowers is a you-pick flower farm that is part of Langland Farms, one of our members. So she is going to be with us for a lunch and learn on Tuesday, August the 9th from 12 o'clock to 1 o'clock. We will provide lunch during that time. So if you want to get signed up for that event, that should be up and online yet this afternoon. So please check out our website, www.greensburgchamber.com and /events, or like I said earlier, just give us a call at the office and we'll get you set up. Second Tuesday of the month is Lunch and Learns. Then the third Tuesday of the month from 4 to 6 p.m. we host Leaders and Loggers at the Tap, which is on the north side of the square. That's Tuesday, August the 16th from 4 to 6 p.m. Leaders and Loggers. And that is a time to just kind of come in and talk to one another. We usually do have a short, brief 15-minute program. And then that whole time is honestly for you to network, make connections, collaborate, maybe find a mentor, whatever it is that you might need, or just to come in and chit chat with us and partake in their cash bar option, and we just usually have a great time. So again, that's Tuesday, August the 16th, Leaders and Loggers from 4 to 6 p.m. at the Tap. So that kind of rounds out the month of August, but today I have the pleasure of having Deborah Potter with me here in the studio. Deborah is the referral liaison of our Hospice of South Central Indiana. Welcome, Deb.
Why, thank you very much.
You're welcome.
Always enjoy coming in and talking to you guys.
This is exciting. So I think we've got a big topic today. I'm super interested to talk with you and really define some of the things that you do. So let's start off with referral liaison. That's a pretty specific title.
That's
so
very
can you tell
specific.
us what that means?
Oh, absolutely. I talk to families families and patients about hospice services and how that service can benefit the patient as well as the family, wherever they choose to have services. And unfortunately, a lot of people don't inquire about hospice until at the very end. And there's so much more that we can do for patients and their families.
Okay.
So I talk to families before they go in service at the hospital, in the home. Sometimes I just meet with them to talk about hospice because they know they're eventually going to be needing it in the near future. And so I talk to them about hospice because most people go, oh, I had no idea.
Gotcha.
So we've been around for 42 years,
Wow.
but you know, it's like anything. Nobody wants to talk about it until it's time.
It's a tough subject.
Yeah.
So let's define hospice first,
Mhm.
and then we'll talk about. So it sounds like basically, I guess I'm getting way ahead of myself. a referral liaison is. Would you consider yourself an educator?
Absolutely.
Okay.
I think anybody within our organization is an educator.
Awesome.
Especially our nurses who care for patients because they're there to educate the family and especially as to what's going on with them and what to expect.
Right.
And so that really helps in guiding them through this process.
Sure. Probably adds some comfort. I'm assuming.
Yeah.
Okay, so let's jump forward now
Sure.
that I've backed up twice.
There you
What is hospice? What does that mean?
Hospice is for anyone that has an advanced illness or life-limiting condition that they require special care and support of staff that are experts in end-of-life care. Hospice, we provide a registered nurse, home health aide, a chaplain, as well as a social worker, because at hospice, we care for patients physically, emotionally, and spiritually. And I always say we're there 49% for the family, 51% for the patient. It's always more for them, but we're there to supply a support for the family as well too.
Sure.
And that's huge for them.
Absolutely.
It's amazing. Just the end of life is our expertise, and so you'll hear patients that will say, or families, oh, we have a minister, we don't need our chaplain. But I always say it's the same price for 4 as it is for 1. So let's go, try all 4 because there has never been a patient that didn't have social work as well as the chaplain who didn't say, oh my gosh, I wish I'd done this sooner. Such a support for us, not only now, but it's comforting to the patient to know that their family's going to have 13 months of bereavement support after they pass. And that's really huge. It's huge for the patient because they're usually just as concerned about the family as the family is about them.
Sure.
So that's a comfort to them, and it's also a comfort for family members. Even though it's a mobile society, our chaplain and social worker, they'll call and talk to the families, even if they live out of state. That doesn't matter. They're a family member of one of our patients, and that's part of the bereavement services.
Okay. So our Hospice of South Central Indiana is a regional outreach. Can you tell us what counties you serve or what area?
We service 16 counties.
Wow.
A lot of people don't realize that.
Yeah.
Don't realize that we're actually a pretty large company. But I service the Greensburg territory, which is Rush, Shelby, and Decatur County.
Okay.
And then we're also in Johnson County, Brown County, Bartholomew, Jackson, Franklin, Dearborn, Ripley, Jennings, Scott, Clark, Jefferson. We're also in Switzerland County, down in Vivi.
So for those of you who are listening, she does have a list in front of her.
Yeah, I do have a list.
Counties to memorize.
I know my territory.
Yes, absolutely.
and really, I tell people it's from Shelbyville, if you're going down 74, Shelbyville, down Shelby County, down to Cincinnati.
Okay.
Obviously.
Perfect.
And then on 65, it is from Franklin down to Louisville.
Okay.
So that encompasses a lot.
Yeah.
There. So some of it's overlapping, but which is kind of nice that we're able to provide extra support, so to speak. Yeah.
Sure. I don't think you can ever have too much support.
Absolutely not. Absolutely
Yeah.
not.
Does hospice provide 24-hour care in the home?
We do not.
Okay.
Hospice care is about additional care for the family. So we're not the main provider. Even though our staff, they assess, they monitor and treat symptoms, as well as, like I said, teaching families about what's going on. But we're not there 24/7, but we are available 24/7.
Okay.
We're, a lot of times patients, families are like, well, I don't want people coming in and out of the house. They're really concerned about that. And we're not very intrusive. We're there as much as the patient needs us.
Gotcha.
So, but the good thing is, if the patient needs us on a holiday, on a weekend, middle of night, they have a number to call and we come to them. So, for most patients, when they first start, our nurse may see them once or twice a week. Our home health aide comes to the home or wherever twice a week as well too. So there is a lot of assistance there in that, but we're not in the home the whole time.
Okay, so you don't offer 24-hour care in the home, however, you are available 24/7.
Absolutely.
Okay.
Yeah.
Perfect.
And we also have, we're one of the few hospices that have an inpatient facility over in Columbus.
Okay.
And that is used for a patient who has a symptom that's not being managed or having difficulty managing it. And we talk to the patient and the family, let us take you to our inpatient facility, so you have that 24-hour care.
Gotcha.
And we can get that symptom managed. The majority of our patients go back home, because that's the goal of it, is to get the symptom managed and to go home, go back to wherever their home is. Family members can still meet with them, still come and see them and such, but it's very advantageous to know that, because it is a little scary to know, oh, I'm not going back to the hospital, but at least I have a plan B. I can go to the inpatient facility if needed. Our inpatient facility is also used for respite care. Respite care is when, caregiving is difficult because it is a 24-hour, 7-day-a-week job. So we have respite care where we can care for the patient either at our inpatient facility or at extended care facility in their area of their choice. And it's up to 5 days per month. It gives everybody a break. Wherever they are, you can still go and visit, your loved one, but it gives sometimes you just need sleep more than anything. And that's what you'll hear family members will say, oh, I just needed to catch up on my sleep and now I'm refreshed and I can do this again.
Sure.
And so that respite, and it's paid 100% if they have Medicare, it's paid 100% through Medicare. So it really is nice for them. I've also had people that, when you're caring for someone, your life kind of gets on hold. They can't go on vacation. They can't go to like maybe a graduation or something out of state. And we want, families to continue living as well too. So we have, that's considered a respite where they're going to come in, the patient's going to come in and we're going to care for them for 5 days while their loved ones, their family's going to a special event, a wedding or something to that effect, or a small vacation. Because again, that's good for them, it's good for the patient, and we want quality of life for everybody involved.
Right. So you mentioned some care that is inpatient care through our hospice. Can people also get hospice care through an inpatient facility such as an assisted living or an extended living facility?
Absolutely. Hospice is offered wherever the patient resides.
Okay.
We've gone to hotels, we've gone to nursing homes, we've gone to assisted living, private homes. Wherever that patient resides, we're going to provide service to them. I know we've had some patients that reside in maybe a camper. That's fine with us. We still go and provide service because we truly believe everybody has a right to hospice, and we don't judge anybody. We're there to provide care and to provide comfort and support to them.
Awesome. So we've thrown around the term comfort quite a bit, and I've heard the term or the phrase comfort care several times. What is that? Can you explain what comfort care is?
Oh, absolutely. Comfort care is when we're focused on symptom control, pain relief, quality of life versus quantity of life. Also providing emotional support and spiritual support for the patients and the family, like we discussed. It's when patients are no longer going to be receiving any type of aggressive treatment, and so or any type of what's considered curative treatment, and so that's when we'll receive a referral on a patient for comfort care. They're no longer receiving any type of aggressive treatment, and they're focusing on quality of life.
Gotcha. Keeping them comfortable, which
Absolutely.
is where the term comes from.
Mm-hmm.
Awesome.
Yeah.
Awesome. Are there different hospices throughout our region or throughout the state, and how do they differ, or how do we know who to call?
There are other hospice agencies.
Okay.
We are a not-for-profit agency. First off, we don't care where they live, or we've had homeless, we've had if they've been underinsured. We have a whole department that raises money so that we can provide support for any of those patients. We do a golf outing here in Greensburg. Every territory does an event where we raise monies, and that's where those monies goes to, is to help those that are underinsured or don't have insurance.
Awesome.
Yeah.
Awesome. And your golf outing is when again?
It was in June.
It was in June.
It was in June, yeah. I think we raised, it was maybe, I can't remember, but I think it was like $32,000. We raised quite a bit
That's
of money.
Awesome.
That's awesome. And that money is used here in this territory. So it really is, the golf outing is kind of, it's very touching to go to, because most of the people that are golfing have had a family member on hospice services.
Sure.
And so it's a lot of them will come up to me, I remember you coming in and talking to us, or if a nurse is there, they'll get very emotional in talking to the nurse, and we'll tell them about what's going on, and now that their loved one has passed. But it really is a nice event. We focus, hospice is about helping. It's not about dying. We don't focus on that. It's about living and helping that person go through this journey.
Sure. So let's talk about some of the details of hospice, because I think there's just so many unknowns, and people are just so, I don't want to say confused, but maybe just don't know. You don't know what you don't know. It's one of my favorite phrases.
Yep.
What about things like prescription medications, and do those types of things continue when somebody
Absolutely, they do. On hospice, your medication is paid through that hospice benefit. Any medication that you're on that's relative to your hospice diagnosis is paid for. We're not there to give it to them, but we're there to manage it. Our nurses manage it to make sure that they have what they need, they don't run out, or if they need something different. We keep patients on their medications. They being the physicians, our physicians will review that periodically, because when somebody is losing weight, you may not need the medication. The medication may start, you're at a point where it's counterproductive. So they review all of that, and that's when they'll start taking medications away if it's harmful, because it happens a lot. Or as time goes on, in their disease process, like dementia patients will lose the ability to swallow, and so if it's causing harm to the patient emotionally, like I don't want to take it anymore, I'm done, then we take them off the medications then, because again, that's all part of the comfort care that we provide.
And like you said, under the direction of your physicians.
Yes.
Yep.
Yes. We never do anything. It's physician led. We never do anything without them telling us and giving us the order for whatever the patient needs.
Yeah. Yeah. So if somebody feels like they have a loved one who maybe it's time to think about hospice, I know you mentioned at the very beginning of the program that sometimes people wait too long, or they wait until those last few days or weeks. When should we be thinking about our hospice?
You should start thinking about hospice when you're no longer going to have any type of aggressive treatment. Okay. If a patient has been going to the hospital nonstop, because you'll hear them, they've gone to the hospital this week, they were there 3 days, the week before they were there a week, and each time they're discharged, they never get back to where they were when they first went in the hospital. So you really start seeing that decline, and that really is a time to call us as well too, because we can help with that. We can help the patient, and sometimes it's the family that is having a hard time with it.
Absolutely.
More than the patient. The patient's ready, but the family is not.
Sure.
But if you'll have patients that will say, I don't want to go to the doctor anymore, I'm tired of going to the hospital. Definitely call us then, because that's when we can help. But really, even if there is a question as to, I think mom meets criteria, but I'm not really sure, we do evaluations on patients.
Oh, perfect.
And it really is helpful, because we'll have patients, that family members that will say, I don't know if they're ready, we're getting conflicting information, and we'll do an evaluation on the patient, and the nurse will do that evaluation. She'll contact the physician. The physician, our hospice physician, will say, yes, she meets criteria or not. Sometimes they say, right on the cusp, let's give it about 2 more weeks, we can reassess in a couple of weeks, because historically she is declining. But we do those because you'd be surprised, the family is so grateful, as well as the patient, in knowing, are they ready or are they not, so that when they do go on service, they feel good that it's the right time.
Right.
And even when we've had to say, maybe in a couple of weeks, let's reassess, families are very, very appreciative of that.
Yeah.
Because again, the sooner you can get on, the sooner you can get all the benefits that go with it. You have that emotional support. Family members get that emotional support in the social work. We can help with so many things. That's huge for them, and they usually don't have any idea. So, we're never bothered by if somebody wants an evaluation. A lot of times we'll suggest it, but if somebody wants just an evaluation, sure, we'll do that. If you, usually it takes an order from a physician to come to be on hospice, but it doesn't have to be. If you can call hospice yourself and say, I'm really interested in hospice, could I have a nurse come out and assess my mother? And absolutely, we get actually what we do is we get their date of birth, the patient's date of birth, and we collect medical records from either the hospitals they've been at or their physician offices. So we have a complete picture.
Sure.
So when the nurse goes out there and she does the assessment, and when she calls the physician, she has both the documentation as well as the physical assessment. But that anybody can call and do that if there's if there is a need, and they go on hospice services. And like I said, hospice for Medicare patients, it's paid 100%. All of our services are paid 100%. The medication, as we discussed, any equipment that they may need. I've had patients, families that will say, we've been trying to get a hospital bed, and it's been a month, and for us, we get them usually the same day, within 24 hours. But they're so relieved, they have no idea that hospice benefit includes any equipment like oxygen,
Sure. Yeah.
Any type
That's
of
huge.
oxygen, wheelchair, bedside commode, anything like that. So that's so beneficial for them to
Absolutely.
have that, and the fact that they don't have to call on it themselves.
So a family could call hospice and say, I have a family member who I think might be ready, but I'm not sure. You will come out and do an evaluation, and as far as the family goes, they don't have to do any kind of legwork prior to that.
Right.
They don't need to call their insurance company.
Nope.
Or anything like, they don't have to have things
No.
ready. You'll just ask a couple of basic questions, provide a profile to
To the nurse.
who comes out, and then the nurse will talk to the physician there through hospice.
Yes.
Okay.
And we're a large company. We actually have a whole department that will get medical records. We give them the information, and that department will seek getting the medical records. And hospitals, physician offices know it's hospice, that when we call for it, we need it.
Yes.
So they're very, very good at getting it to us same day.
That's amazing.
So that we can act quickly for the patient and the family.
Yeah, so helpful, so beneficial. have you ever had people who have started on hospice and then who have come off of it?
Absolutely.
Okay.
Sometimes patients get better.
Sure.
They're having the additional care, even like in a nursing home. You know, they're getting all this care from us. They get better, and you always have to meet criteria to stay on hospice. You got to meet criteria to go on hospice, and then after that, they're going to assess you periodically and making sure that you still meet criteria. If you've gotten better and you no longer need us, we're like, woohoo, you know.
Sure.
Just call us when you need us. We don't penalize you. Medicare doesn't penalize you. Now granted, we have had some patients that are excited and they went, wait, I'm losing my nurse, I'm losing my home health aid.
There's some stability.
Wait a minute.
There's
I don't
that
feel good
comfort
after
again.
all.
Right.
So it is something to think about, that just because you go on hospice doesn't mean the end is right around the corner, so to speak.
Right.
Because patients get better and come off of hospice services.
Sure. How does somebody get in contact with you? What is the best way for them to reach out if they have questions or if they are thinking about needing an evaluation?
I will give you 2 numbers.
Okay.
Our Columbus referral office is 812-314-8083, or they can call me direct. It is 812-603-9933.
Perfect. And I'm assuming there's a website associated?
Yep, we are at ourhospice.org.
Ourhospice.org. And then she just gave 2 different numbers. I'm going to try to not butcher those. The Columbus office is 812-314-8083, or calling Miss Potter direct, 812-603-9933, and ourhospice.org is the website.
That is correct.
Perfect. Deb, is there anything else that you would like us to know that would help or be beneficial to our listeners?
No, I just want our listeners to know to not be afraid to reach out, that we're there for them, we're there to help them, and even if we do an evaluation and they don't meet criteria, we never waste our time. That is a value. So we want patients and their families to know, don't ever hesitate to call us. Even if you're just wanting a couple of questions answered over the phone, we do that as well too.
And it sounds like no time is ever too soon.
Correct.
Almost the opposite, where you could potentially wait too long.
Yeah,
but don't
absolutely.
be afraid to call too
You
late.
know, when we get sometimes circumstances, that something might have happened, a massive stroke or something like that,
Sure.
and when we get a patient, it is the last couple of days. But it kind of breaks our heart because we're not able to offer all the other, the chaplain or the social worker, to really provide all those services and the support that they need to help them. It's starting with their grieving process. Grief doesn't always start when the patient passes away. Grief can start beforehand as well too.
Absolutely.
So we're there to help with all of that. So never too early to call. Even if you just have a couple of questions, we always encourage calls.
And you said that services continue after the death of a loved one for 13 months?
Correct. We provide bereavement services for 13 months.
That's awesome. What an amazing organization.
It really is, because we provide care to babies. People just assume that hospice is for the elderly, and we provide service for babies, toddlers, teenagers. I mean, it just goes up. I have a 105-year-old referral today. Last week I had a child. So, but we provide services for all that. All of our nurses are trained how to provide that type of service, and it's because it's different for children. Most people don't know. Pediatric hospice, they can continue on their treatments. So if they're a cancer patient and they needed some sort of treatment, a chemo or whatever, they can continue doing all of that. Pediatrics is just a little bit different.
Gotcha. Well, thank you for what you do. I think that it takes a special person, a special group of people to be able to provide the services that you do, to handle the different things that you do on a daily basis. So we want to thank you again for not only being a chamber member and supporting the local community, but just doing what you do. I think it's
Thank
amazing.
you.
You're
Yeah.
welcome. Well, that is Deborah Potter, who is a referral liaison with our Hospice of South Central Indiana. Thank you so much for being with us, Deb. And Deb was actually just at our Women in Business conference.
Yes, yes, I was.
Yeah, and ironically, got not one but two of our door prizes just randomly selected.
Yeah.
So
There you go.
that was a fun day. We were
I
like,
was
oh,
pretty-
really? It's Deb again.
I was pretty excited about that because usually I go to those things I don't, I
Right.
just sit there and smile like,
Are you
no, I
like
never
me?
get
You
any
never
of
win
those.
anything?
Never win anything.
No.
So,
Well, we made up for it. At the
so
Women
but
in
I'm
Business conference.
that winner that is like raise my hands and woohoo,
Yeah,
I
yeah.
get a little crazy. You think
That's
that I
okay.
had,
We like crazy.
you would think that I had just won the lotto, but
To us, it is like the
Yeah.
lotto.
It's
so.
fun.
It wasn't the, what was it, 1 point whatever billion.
yeah,
we just,
I know.
Yeah.
Someone in
Yeah,
Ohio, I think,
congratulations
won that,
to
yeah.
them.
Illinois.
Illinois,
Yeah,
was it? I think
yeah.
it was one of the sides of us.
Yep.
Before I go, I would just like to say that we have a concert coming up on Labor Day weekend.
Okay.
So the Yacht Rock Review is the name of the
Yes.
band that's going to be
Yes.
playing for us. It's a free concert at Columbus. It is our big fundraiser for the year. We're super excited because we haven't had concert in person.
Right.
It's always
Yeah.
it's been online because of the pandemic. So after 3 years, I think we get to have it again.
That's awesome.
So we're really, really excited about it. So, come on out. I think it's September, Labor Day weekend. It's Saturday, September the 3rd.
Okay.
We also have tickets for a raffle. It's $10 a ticket. 5 for $50, 10 for $100. I'll keep going.
So if you're
But
looking
it's
for Labor Day plans, that would be a great fun event. Is it family
Yeah.
friendly?
Absolutely, and
Awesome.
it's an opportunity to win $10,000. That's what the raffle is.
There you go.
But it's a
And
really,
support
really
a great cause
Yeah.
in the meantime.
absolutely,
Very cool.
absolutely. So I really appreciate you letting us come in. We're a big proponent of the chamber, so we appreciate you letting us come in and talk about hospice.
Well, absolutely. I think it's definitely a topic that we need to be more educated on, and we appreciate, like I said, all that you do, the services you provide, and the support that you give to our community. So
Thank you.
thank you again for being with us. I'm going to pass it over to you.
Pass it on over to me. I
Yeah.
like it. Alrighty, 11:49 here on Tree Country 1330. This concludes the first Community Connections of August. Very exciting. It takes away a little bit of the scariness, I think,
Yeah.
with hospice. People get nervous about it,
unknown.
and it's good to talk about it because it makes it normal.
Absolutely.
But anyway, I
Absolutely.
believe we'll be back on the third Monday
third
of
Monday.
August, and I believe that's Centra Credit Union. I believe is what it says
You
on my
probably
little
know
list.
better than me. I'm
I
going to
got
go back
the
to the
list
office
taped
and
up
look
right
at
there.
the list.
Alrighty. Well, thank you both for being here and talking.
you.
That's what this show's about. Making connections with the community. I'll say that again because we didn't have our intro.
We'll have
11
it on the third Monday, though.
There you go. We'll fix it. 11:49 here on Tree Country 1330.